Welcome back. Well, Halloween is at the end of this month, but unless you want to be Spider-Man or Spider-Girl, this is a great time of year to get rid of those unwanted veins.
Yeah, we are here with Dr. Deborah Manjoney from the Wisconsin Vein Center MediSpa to talk about those scary things.
Right.
Great to see you.
Thank you. Nice to see you, too.
It's tough because I know sometimes they can be a sign of a medical problem, but the reality is they look so unsightly, and I think people are so self-conscious about them.
Really, and women start getting them sometimes in their teens or earlier. You know, when we see some people in the office, oh, this I was 10 years old. And I said, really?
Yeah.
But 70% of women will spider in their lives. So very rarely can you associate it with another medical problem because it's going to get, it really depends on where they're located.
Okay. Summer's over, so a lot of people think of the fact that you have to wear compression stockings.
That's right.
And this is because compression stockings aren't like old ugly stockings anymore. They look like nylons.
They look like nylons.
Yeah.
You can get them in all kinds of even different colors and prints and things if people really are concerned about wearing them. But you only have to wear them about 5 days after any treatment. And so it's a good time of year because it's gotten cooler, as we can tell.
Yes.
Yeah.
And so it's a lot easier to wear the stockings.
Yeah, and it's a great time to prepare now for next year.
That's right.
So that you can show off your legs and during the skin-bearing season, which is great. So you have a couple of different unique treatments. Let's break it down for spider veins, because some of them I know you use in conjunction.
Yes, we use things together. The gold standard of treating any kind of varicose veins or spider veins that are very small is sclerotherapy, where we inject an irritant into the vein to get it to go into spasm and close off. But we also combine that with some surface laser treatments. So we have a little laser where we trace out the spider veins, as we're seeing here.
Does that hurt?
It doesn't really. It feels like a little hot hand on the surface that doesn't penetrate at all.
I've had that done before,
and
I don't think it hurts either.
Right. And the injection is also very tiniest needles. And so you'll barely feel it. It's like you feel the needle on your skin, you're waiting for it to hurt, and it hurts more than that. And so we do a combination. We first with the laser, and then we'll inject. And the premise is that we're going to injure the vein from the outside and from the inside.
Okay.
So we're injuring outside with the laser and then from the inside with the detergent sclerosing.
Look how much better that looks.
Yes. Well, it usually takes, it's a process to treat spider veins. So it's not just going to be one time and you're finished. It's going to be 2 or 3 treatments, usually to get clearance of an area. But it works very, very well. And, you know, if you start now, you'll easily be ready by next summer.
And you use intense pulse light sometimes also, right?
When somebody has really a matting or real fine spider veins on the surface, intense pulse light works very, very well because it's attracted to that pinkness or redness that are in the vessels, and it can coagulate them or close them off, and then they get absorbed by your body and disappear. So we have all those options. We have intense pulse light, we have the diode lasers you saw, we have the injection sclerotherapy, and we can work with people, you know, to find what's best for their problem.
So you said it takes a couple treatments sometimes. Usually, how far apart are they?
About 6 weeks apart.
Okay, about 6 weeks apart.
Because you'll start to see the body absorbing some of those blood vessels that have been injured and destroyed over that period of time.
So in the before and afters that we see, generally speaking, how much time has elapsed between those?
Probably 2 to 3 months.
Okay, so it's not something you see immediately.
You will start to, you'll actually have a little bit of discoloration, sometimes a tiny bit of bruising for about a week or so after, and then the veins will start to disappear. And usually the first treatment you have, it's rare for people to see a lot of response, but some people do see amazing results. But by the second treatment, after you've had your second treatment, that's when you really start to see the fading and the disappearance of these veins.
Are spider veins genetic or are they lifestyle related?
Both.
Okay.
Absolutely both.
Is it, you know, because a lot of people hear crossing your legs and heels. Do those two things matter?
The heels, no. The heels are more important for keeping your veins healthy because as you walk and your calf muscle contracts to empty the veins in your legs, that's going to work much better and keep, you know, so you don't get varicose veins and have other problems with that. So crossing your legs may, in some instances, really prevent the blood from returning to your back to your heart and slow things down a little bit. So you might get a few spider veins, but it's probably not making a big difference.
Okay.
So it's more, you know, persistent standing during the day, doing things where, you know, you have hormone irregularities. A lot of it is getting bruised. You might have a bruise that leads to spider vein treatment, spider vein formation. So there are a number of different things.
I love that during the month of October, you're doing these Halloween specials about spider veins.
They're
Tell us a
scary.
little bit about it because we want to put up the information for this special. I think it's great.
So the spider vein treatment is 20% off of a single treatment throughout the month of October. And we have several other specials going on in October. We have a Botox special, which is for Botox. At $9.99 a unit. And we also have a special on
What is it? Say it louder. Oh yeah, the
right.
vampire
Thank
facial.
you.
Oh, yeah, of course.
Sorry.
Yeah, that's okay.
So we're doing the microneedling with your own PRP, your own platelet-rich plasma.
It's awesome.
Right.
Call
So
the
vampire,
Wisconsin Vein,
the Botox, and the spider veins.
call Wisconsin Vein Center MediSpa right now and take advantage of the October specials. They'll help spook you out there and get rid of those spider veins, a lot of other fun things. 262-746-9088 or WIMedispa.com. They're located in Pewaukee and have a beautiful MediSpa there. Great to see you.
Thank you so much.
Thank you so much.